My name is Franchesca Cullinane. I am 25 years old and a mother of 2 children. My story began in September 2013, after the birth of my second child, Louis, was born at 8 pounds 8 ounces via a natural water birth without any complications. Unfortunately, within an hour, I had complications with the delivery of my placenta, in which I suffered a hemorrhage that left me in the weeks to follow severely anemic. 3.5 weeks after my son's birth, I encountered unfamiliar pains in my left groin, lower abdomen and lower back. I attended my GP surgery, where a urine sample was taken. The next day, which was a Friday, I can remember this day very clearly, as my partner and I were registering my son's birth. Walking from our car to the registry office, I experienced severe pain radiating down my left leg, literally stopping me in my tracks. I visited my GP surgery, and my previous urine sample was negative. And my GP was concerned about my symptoms, so attempted to refer me to the medical team in my local A&E department, but they refused to see me. My GP suggested that I keep an eye on my symptoms and prescribed me anti-inflammatory medication. Later that evening, I was crying in pain. My partner and I examined my leg. It was discoloured and very swollen. I went back to see my GP, who referred me straight to A&E. On attendance to A&E, I was seen by a doctor, who, after examining me, called for the registrar to examine me along with a doctor from orthopaedics. Neither of them gave me a diagnosis, but admitted me that evening with the plan of seeing the consultant in the morning. On the Saturday morning, I was examined by the consultant and was diagnosed with a muscular injury, which was sustained from giving birth. I questioned this diagnosis as I had been Googling my symptoms and asked if there could be a possibility of me having a blood clot. The consultant said no. He did not think it was a blood clot, as I could move my toes, and a nurse also added that my leg would have been black. I was discharged and told to wait 3 to 4 weeks for an outpatient scan. Saturday and Sunday passed. I was in severe pain, and I was anxious and frightened. I could hardly breathe as I encountered my first panic attack. On the Monday morning, my leg was 3 times the size of my right. I was in agony. I visited my GP. I was seen by a different GP. I was examined again, and I was referred to A&E and told by my GP that I needed to be reinvestigated immediately. In A&E, the doctor read my previous notes. He looked at my discoloured and swollen leg and could see I was in severe pain. My shoe would not fit on my foot, and I could not walk unaided. I told the doctor that I was very concerned that I may have a blood clot. He did not agree and explained that he could see from my notes that 2 days ago an outpatient scan had been booked for me for a possible muscle injury. And if he was to rebook it now, then I would go to the back of the queue. He stated that I was not urgent enough for an emergency scan. I asked him what would happen if I did have an undiagnosed blood clot. He explained the process of a DVT turning into an embolism. I had then asked several times for him to scan me to rule out a clot, but he refused. He offered me Oromorph for the pain, which I refused due to having 2 young children to look after, and I needed to be alert. Because I refused the Oromorph, I was made to feel as if I was wasting their time, and words to this effect were exchanged. I was then sent home. The next day, my GP contacted me at home to find out how I was and wanted to know the outcome from my visit to A&E. I explained what had happened, and she was very concerned. She told me to collect a letter from her immediately, take it to A&E, don't leave the hospital without a diagnosis, just refuse to leave if you have to. I collected my firmly worded letter from my GP and presented it to a doctor in A&E. This was my 4th visit and the 6th doctor I had been examined by. I explained to the doctor that I suspected I had a blood clot. He looked at my leg and performed a Doppler test. He confirmed that he suspected I had a clot in the vein. It was at this point that I was given my first dose of Clexine. I was discharged that night with an appointment to return in the morning for an ultrasound scan. The next morning, the scan revealed I had a large DVT in my iliac femoral veins, ranging from my lower abdomen through my left groin into my left knee. I asked, was it a big clot? And I was told that the size wasn't the problem, but it was the location that was concerning. I was then prescribed warfarin and told to await a haematology appointment. From the time of being diagnosed with a DVT to the time of my haematology appointment 3 months later was when I was at my absolute lowest. The realization of the seriousness of a VTE had kicked in. Knowing it could have killed me, I was in shock. I was angry at all the should-haves, could-haves, and would-haves. I felt neglected and did lose faith in my local A&E department. But I also felt reassured that I trusted and had full support from my GPs. I felt that these months were a blur. I still cannot remember normal day-to-day events surrounding my family life. The condition took over my life both physically and emotionally. I suffered constant anxiety and daily panic attacks. This was especially hard with a newborn baby and a lively 2-year-old child. The panic attacks were by far the worst, as at this time I could not differentiate between the symptoms of a panic attack to those symptoms of a PE. The symptoms were so similar, I was terrified. With a new baby to look after, you would expect one to be trying to get as much sleep as possible. But in my case, the tightenings in my chest, the palpitations and shortness of breath made me too frightened to go to sleep in case I never woke up. I couldn't wait for my baby to wake for his feed, to take my mind off what was happening to me, as well as thinking when I put my eldest son Jack to bed, it could be the last time I did this because of my fear of dying. I visited my GP on a weekly basis. It was suggested that I may be suffering from post-traumatic stress disorder from my ordeal. I felt very alone going through this. Even though I had lots of support from my partner and my family with looking after my children, they did not feel my feelings. I did doubt myself. Panic attack or PE? Was I having irrational thoughts when the symptoms themselves were practically identical? More pain in my chest today than yesterday? Is it a new clot? Is it a PE? Were they rational? And I feared becoming complacent. Trying to come to terms with what had happened to me, I wanted to know everything about my condition and what lay ahead for me in the future. At this point, on what I call my obsession with Google, I had read hundreds of papers, articles, forums, and literature reviews, seeking every bit of advice, theory, and fact possible, hoping to find a light at the end of the tunnel. This was when I found my friend Charlie on social media site. I was so excited I couldn't wait to tell my family and friends. I couldn't believe I had found another person in the whole world who could relate to everything I was experiencing, as she herself had suffered the effects of VTE. I no longer felt alone, and together we supported each other. For someone else to say, "It's happened to me," was amazing. We are now very good friends and continue to support one another. 3 months later, January 2014, I met with my consultant haematologist, Dr. Sarah Lewis, for the first time. She explained that in her opinion, the clot was caused by postpartum pregnancy, and because of the good birth weights of both my children, and with no family history of clots, she was confident that that was the reason, and she was happy for me to come off warfarin after 6 months. I explained to her that I was still concerned that my left leg was still 2 to 3 times larger than my right, and I was still experiencing daily discomfort and discoloration. Dr. Lewis suggested that I have another scan, and this revealed that there was residual clot left in the vein and the valves were damaged. It was then that I was diagnosed with post-thrombotic syndrome. I was prescribed more suitable compression stockings and given another appointment for 3 months to conclude my warfarin treatment. After this appointment, my panic attacks were more frequent, as I felt that my safety net, warfarin, was going to be taken away from me, and I began doing more research. Upon my next appointment with Dr. Lewis, I stressed my concerns about being taken off warfarin, as I was frightened of a reoccurrence blood clot. Dr. Lewis could see the obvious psychological effects this was having on me, and I cried from one appointment to the next. I explained that I had been researching and asked Dr. Lewis if she would perform genetic tests on me, which, if showed negative, I would be prepared to discontinue the warfarin, as in my thinking, there was going to be a lesser chance of me having future clots. Dr. Lewis agreed to do this and was prepared to do whatever she could to put my mind at rest. July 2014, my test results were back. Dr. Lewis diagnosed me with compound heterozygous for factor V Leiden and prothrombin gene mutation. I was told I was to be on warfarin for life. Leaving my appointment, I felt relieved in a way that I would be keeping my safety net, warfarin, and me being me, back on Google I went, where I thoroughly researched my disorders. Some of what I read terrified me, but it was what it was. My biggest concern being that my children have a 50% chance of inheriting these disorders from me. But Dr. Lewis reassured me that because I have boys, the risk was less and that they would be tested at the age of 16. It's been 18 months since my diagnosis. I have weekly INR tests, as I find this helps my anxiety. My panic attacks have lessened. Life for me now is that I live it day to day. I have good days and I have bad days. On bad days, I can experience chest discomfort, shortness of breath, and I am generally anxious. My post-thrombotic syndrome restricts my mobility, but I try my best for this not to rule my life like I did for the previous year or so. When I get a new pain or symptom that I cannot relate to what is normal for me, I seek medical advice. Although I find this quite challenging at times to try and get past the barriers of the health professionals, as most of the time I am told it does not matter as I am taking warfarin. I feel as if I'm in a vicious circle, as being so body aware of the side effects of warfarin, I'm keeping an eye out for a potential new clot as well as a potential bleed. This in itself is very stressful. It's on my mind every day, and it's a factor to how I have to make daily choices. My condition hasn't just affected me, it's affected my whole family. And without their support, I don't think I would have come this far so quickly. And for that, I am very grateful. I am also very grateful to my GPs, Dr. Williams and Dr. Davis, who have supported me and continue to support me. I feel that if it wasn't for their persistence of getting me seen in A&E, I may not be here today. And for that, I thank them. I have also had much support from Lifeblood, now Thrombosis UK. Even though I didn't find them until the major events had taken place, they have and continue to be a support system for me on a daily basis. I have met lots of friends through Lifeblood, now Thrombosis UK, and will be taking part in a walk in July to raise money and awareness. I would like to say thank you to Lifeblood, Thrombosis UK, for giving me the opportunity to tell my story here today. And I hope that my story will help anyone going through a DVT or PE journey know that it will get better. It just takes time. Thank you.
Franchesca, stay there. So that was stunning. I don't know what to say, as it was missed. And you've told us all about the psychological consequences of having VTE. Whilst you were talking, we've got another day going on in Cardiff, and somebody was actually giving a lecture about the psychological consequences of VTE, but you have told us yourself so eloquently all about it. I'm a bit stunned at how awful your story is. Does anyone have any questions for Franchesca?
Hi there. I just wanted to say your story was amazing and you told it so well. So thank you for sharing it with us. I wondered whether it's quite recent that you've had your clots. I wonder whether you've been offered any kind of help with the post-traumatic stress or you've had any support from in form of therapy or talking to somebody?
I have, yes. My GPs, like I said, have been great, and they have referred me for CBTs and things. But unfortunately, because of the thoughts that I have and what I actually have my anxiety about, they can't really help me because it's not actually irrational what I'm thinking. So, you know, to try and change my way of thinking, or, you know, is nothing, just leave it, when I need to be body aware, is quite a difficult one. So I've just found by talking to my GPs and my, you know, my family has sort of helped me.
Yeah, I can. I've had, my story was very, very similar to yours actually. So I'll perhaps chat to you about it at lunchtime. But
Yeah,
it seems that you've done really well through the support of the charity. So
yeah, they have.
I'm
Yeah, they've
really
been
pleased to see
great.
that. Lovely.
Thank you.
Very good. Any other questions? Okay, well, thank you so much for sharing your story with us. I hope you're going to write it down. Or is it already written somewhere?
Yeah.
Fantastic.
Thank
Thank you
you.
so much.